When people develop pain in the foot or ankle, it's very natural to want a clear explanation, a single cause, a specific structure, a moment when something went wrong. That expectation makes sense. Many everyday problems work like that. Something breaks, it gets fixed, and the problem is resolved. Foot and ankle problems often don't behave in that tidy way, not because anything has been missed, but because the system itself is more complex than it appears. The foot and ankle sit at the meeting point of multiple demands. They manage load from the body above, adapt to the ground below, and respond over time to work, activity, footwear, habits, and aging. These influences don't arrive one at a time, they overlap, accumulate, and interact. What someone feels today may reflect something that developed gradually, fluctuated quietly, or adapted in ways that were initially helpful before becoming problematic. This is why similar symptoms don't always mean the same thing. Take two people who both describe pain on the outside of the ankle. Mary is in her early 50s and works in an office. Most of her day is spent sitting, and outside work she enjoys singing in a local choir. Over the last couple of years, she's noticed increasing stiffness through her feet and ankles, particularly first thing in the morning. More recently, she's developed a persistent ache on the outside of her ankle that seems to build gradually over the day. Paul is in his 20s. He studies geology and runs ultramarathons. He's used to long hours on his feet and pushing his body hard. A few weeks ago, he twisted his ankle on uneven ground during a run. Since then, he's had sharp pain in almost exactly the same area Mary points to. If Mary and Paul were sitting in the waiting room together, comparing notes, they might easily conclude they have the same problem. The symptoms sound very similar. They point to the same place. The language they use overlaps. Yet when their situations are looked at more closely, they begin to diverge. In Paul's case, the pain follows a clear recent event. The tissues involved have been asked to cope with a sudden, unfamiliar demand. In Mary's case, the discomfort has emerged more quietly, against a background of gradual change over time. The findings that make sense in one situation don't necessarily explain the other. This difference matters because it shapes the conversation that follows. Although the symptoms sound the same, the wider context is not. That difference changes how a clinician understands what's driving the pain, and therefore, what kind of explanation, reassurance, or next steps are appropriate. This is often where confusion arises. Two people describe the same problem, yet they leave the consultation with different discussions and different plans. From the outside, that can feel inconsistent or unfair. From a clinical perspective, it reflects the fact that symptoms don't exist in isolation from the person experiencing them. In everyday clinical practice, doctors routinely review scan reports before meeting the person they relate to. Sometimes, two reports look almost identical. Both might describe thickening of the plantar fascia, with nothing in the wording that clearly separates one from the other. The first patient is Sarah. She's in her 40s and spends much of the day on her feet. She describes severe pain when she gets out of bed in the morning, difficulty walking even short distances, and significant disruption to daily life. The second patient is James. He's in his early 30s, works at a desk, and stays reasonably active. He's noticed some stiffness through the heel, but the discomfort is mild. His main concern is whether the scan means something serious is developing. On paper, the reports look the same. In lived experience, the situations are very different. When Sarah walks into the room, the focus is on understanding how much pain is affecting her function and what support might be needed to reduce that impact. When James sits down, the conversation is more about context and reassurance, about what the finding does and doesn't mean, and why mild symptoms don't necessarily signal a serious problem. This is also why general information, whether it's shared online between friends or in casual conversation, can only ever be partial. Without the full clinical conversation and personal context, the same information can point in very different directions. Clinical reasoning happens in the space where all of that comes together, not in isolation. Seen this way, foot and ankle problems are rarely fixed faults waiting to be identified. They are evolving situations that sit within a wider system of movement, load, and adaptation. Understanding that difference doesn't provide instant answers, but it does explain why answers are rarely as simple as they first appear.